And welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress. We're coming to you from Washington, D.C. This is WHCC 2018. And in our studio, we have Ryan Schmid, who is of Vera Whole Health, based in Seattle. Ryan, thank you so much for stopping by.
Yeah, thank you. My pleasure.
Tell me about Vera.
Sure. Yeah, we typically contract with large self-funded employers, do on or near site primary care. That's kind of the positioning statement. But I mean, really what we're about is helping people change behaviors. Our mission statement is to help people change behaviors by esteeming them through empathetic listening, which has nothing to do with like medicine, you would think. So really, for us, the delivery model is first and foremost a means to create a relationship between the patient and the care team. And then from there, of course, we layer on top all the buzzwords, population health, medical management, ultimately bending the claims trend. But fundamentally at the center of it, it's about that relationship, which helps people change behaviors, and a model that ultimately is about health, which for us is complete social, mental, and physical well-being, not just the absence of disease or infirmity, which unfortunately is most of what we quote unquote get in healthcare today.
What is the science behind changing one's behavior?
Yeah, well, depending on who you ask, I mean, there's lots of different models. We typically will use a trans-theoretical behavior change model, which is a fancy way of saying you have to first meet somebody where they're at, identify what stage of behavior change they're in, help them tap into what is ultimately motivating to them, and then help them move through the various stages to the point that they ultimately get to maintenance and then develop self-efficacy. I mean, most people think of coaching as change a behavior, right? I'm going to do this thing or I'm going to do that thing and I'm going to change a particular behavior, but that's not actually the goal. The goal is lots of little successes that ultimately lead to self-efficacy because life is going to throw you a curveball, right? You're going to accomplish one thing, but something else is going to come up. And so our job as a care team is to meet that individual where they're at, and they may show up and determine for the first time that they've got diabetes. Well, unfortunately, in our culture today, in lots of communities, diabetes has been normalized. I mean, how many people do you know that will say something like, and it may be offhand, but what's the big deal? I've got 3 brothers that have diabetes. Or it's a shame, but it's becoming normal. And so that patient may end up then seeing one of our health coaches who, of course, understands that the person needs to get their A1Cs under control and exercise and eat appropriately. But that's not motivating to the patient. So if all you say is lose weight, stop eating rice, it's not going to work, right? So the coach may tap into the fact that actually what's important to that person is being around for their kid's wedding or winning the turkey bowl with their brothers. I mean, who cares, right? But they can leverage that to help coach them so that person then actually changes behavior.
Okay. So you're talking about sort of people taking better care of themselves and giving them motivating factors to do that.
Absolutely.
Yeah. What do you see on the horizon for healthcare in general?
Yeah. Yeah, I mean, my opinion is that this is, there is a tectonic shift occurring right now, which is a very exciting one. I mean, today, primary care, which is what we do, it's a loss leader across the country. It is literally no different than grocery stores selling milk at the back. Right? You walk in, you buy milk, the store loses a little bit of money on it, but they know they're going to buy a bunch of high margin stuff on your way out. Right? It's exactly the same model that healthcare uses with primary care. Health systems lose $150,000 on average per primary care doctor that they employ per year. Right? It's a loss leader. But I think that's really changing. I mean, when you look at a lot of the mergers and acquisitions that are occurring today between, the Walmart, Humana, the big carriers, CVS, Aetna, a lot of that is ultimately about controlling the delivery side of healthcare because the market is pushing folks into at-risk contracts. The market is starting to demand better outcomes for less money. Everybody knows the only way that you can actually do that is if you control the supply chain. The gatekeeper of the whole thing is primary care, right? So whereas primary care has been and still is a loss leader, you're really starting to see this shift where it's kind of climbing the food scale, and will start to be valued appropriately. And in the short run, that's going to create a real supply problem. There's not enough to go around, but eventually that will I believe at least, will start to flatten itself out. You're going to see more and more people choosing family medicine as a practice, and I think it'll be a really, really good thing for our country.
Why would Vera Whole Health be a good partner?
Well, I think our outcomes speak for themselves. We've been able to consistently generate best in class in terms of patient engagement, actually reducing total cost of care for medical and RX, patient health outcomes. So we see ourselves as very much a part of the system, and we've invested the infrastructure to be able to participate with the rest of the system rather than just try to go rogue and own the whole thing ourselves. I think anybody that in some respect is interested in driving down total cost of care, whether that's a self-funded employer, Taft-Hartley plan, carrier ACO, a delivery system with an at-risk contract, if you plug in high-functioning primary care as the kind of the front door of that, you have a far better chance of success, and that's intentionally how we've been building and positioning ourselves.
Right. And how are you enjoying the conference?
Oh, it's been fantastic. Yeah, I've met a lot of new people, learned a lot, seen a lot of good old friends. Yeah, it's really nice. I'm coming back.
All right,
Yeah,
great. Thank you so much for stopping
by.
by.
My pleasure.
Ryan.
Yeah, thank you.
Appreciate it.
Yeah.
And I'm Mabel Jong. Thanks for sticking with us. We'll be right back.